ณมหาวิทยาลัยอุบลราชธานีสมเกียรติศักดิ์ศรี
We are happy to interview Ajahn Gregori Rangel, who is speaking to us from Timor-Leste and is an alumnus of UBU Ratchathani University. Ajahn Gregori, can you introduce yourself and tell us what you studied here and what you're doing now?
Okay, thank you very much. Good afternoon from Timor-Leste, Prof. I am Gregori Rangel from Timor-Leste. I was selected to continue my master's degree in UBU Ratchathani University, especially Faculty of Medicine and Public Health, program Biomedical Sciences. When I start my study on August 2016, and I conclude my study on June 2018. So the subject that I was studying at UBU Ratchathani related biomedical sciences.
Let me ask you, what are you doing now in Timor-Leste?
I'm currently working as head of department, equivalent to national director, and under National Institute of Science and Technology, Timor-Leste. The institute has an important role, which is promote research inside the country in all subjects, in all areas. I just come up with the research line. Titles, and do the monitoring, evaluation while the research ongoing. And after that, work as a team, we disseminate the research result and also distribute the research result to our national parliament, to the ministry, relevant ministry, like Ministry of Higher and Education, Ministry of Agriculture. So those projects or research related to the minister, we disseminate the result, and also we distribute the result to the government, to the ministry, to the parliament. So the parliament member or government member will come up with the rules or any formulation related our political decision in the future based on our research result.
Okay, and did Timor-Leste survive COVID reasonably well?
So far we are now free from the COVID-19. So far we are free from COVID-19, but in 2020, start from the March 2020 until end of the 2021, we were in front the problem, which is the COVID-19. So I was working also with the National Health Laboratory at the moment, and as a scientist, I was working with all the team at the National Health Laboratory to collect the samples, diagnose the COVID-19 samples before we inform to the relevant ministry, like Minister of Health, and one team that established or organized by Prime Minister of Timor-Leste. So we need to report everything related COVID-19 progress to that team, and the team will announce to the public related to the progress of the COVID-19 in Timor-Leste.
Wow, very good. It sounds like a big responsibility you have, certainly. And let me ask you, why did you choose to come to Thailand for public health studies rather than another place?
When I came to Thailand in 2013, I was attend one professional training related to malaria microscopy at the moment. I met with Dr. John Story, one malaria expert from United Kingdom. He was working as international consultant for WHO in Malaysia. So when I met with him, I asked his help to find out some course. So he told me, if you want to carry on your master's degree abroad or overseas, you should attend the professional course in Malaysia, postgraduate diploma in applied parasitology and entomology. And I was attend with that course in 2014 from July until December. So after that one, after that course in 2016, Thailand International Cooperation Agency was open or offer a scholarship to Timor Leste. So I was selected by my office or my government to allow me to apply the scholarship. So finally, I was selected by Ubon Ratchathani University and Thailand International Cooperation Agency. So they allowed me to carry on my master's degree in biomedical sciences in Ubon Ratchathani in 2016.
Wow, very good. And I know there's a whole big department and faculty dedicated to public health. How did you find your experience at UBU?
UBU is one public university in Thailand, and I may say that one famous university right now in northeast Thailand. So I found many things in UBU, especially for the College of Medicine and Public Health, like theory. During the study process, I got many sciences or knowledge from lecturer or agent from College of Medicine and Public Health, from various background of the study. Those my professor that graduate from biochemistry, those professor graduate from biomedical sciences department, and others graduate from the different university and different field as well. So relative to theory, our professor, they guide us very well, and also relative practical. So for the practice, enable us enable us as student dealing with the theory. So once teaching us about the theory, we are coming to the lab to do the practice. So everything from the theory and practice, they match one to each other. So improve our knowledge and even guarantee us once we return home, we can do something based on the knowledge and experience or skill that we got during the teaching and learning process at the UBU.
Very good. I believe I read that Thailand is fourth in the world for healthcare and recently passed France in terms of the quality levels. Does that sound right to you?
For the quality laboratory, especially in Thailand, in my opinion, very good. Because I have seen some countries, if they finalize or they conclude their study, they never sleep in the laboratory. But especially for the Thailand, if you want to finish your postgraduate degree, especially for a master's and PhD, you have to sleep on you, or you take time in your lab by reading the book or do the experiment in the lab. Then you have to finish your study on time. But some other country, but I have seen, based on experience from my colleagues, sometimes they are doing some preliminary test only and fulfill the criteria to get the graduation or for the master's or PhD. Especially for the Thailand, it's very tough. One of the tough education system in Southeast Asia.
Oh, really? That's so good to hear, and it corresponds with what I understand also. Then maybe, how would you see do you see a future of collaboration with UBU or working with Thailand?
When I returned home in 2018, before I left Thailand at the moment, I had a dream to open one department specially for the biomedical sciences department in one public university, in one private university. So finally, I realized my dream at the moment. When I came back in 2018, and in 2000 and only 1 year in 2019, I was communicate with another one Thai alumni and two from graduate from Indonesia, and four of us we open biomedical science department in one private university, as I have stated in my document that I have sent to you.
Mm-hmm.
Yeah. So what I dream from this moment, when the situation all okay in Timor-Leste, flights all okay, our economy is okay, and everything will be okay in Timor-Leste, we will have a dream, or we will have a plan. We are coming to UBU to have a collaboration before we are doing something related laboratory or research development in Timor-Leste. But first of all, we have to sign memorandum of understanding between UBU and our private university. That is my dream, but I still not inform all the higher decision maker in that private university. Once I inform him, if he agree with my opinion, then I will send information to the UBU to come up with one draft of memorandum of understanding, and we will have a collaboration, especially for the research and development in laboratory section. Thank you.
Excellent. Well, thank you, Ajahn Gregori, Dr. Rangel, may I say. Would you like to add anything else about just your time at UBU and Thailand?
When I was studying in Thailand, I got message from my family. Please focus on your study and finish the study on time. So, who motivate me? My wife, my children, and all my family. So I have used that time during 1 year and 10 months in UBU to finalize my master's degree. And I did not go to anywhere in Thailand. Only Bangkok, Ubon Ratchathani, and Timor-Leste. I did not go to anywhere. So I have commitment to finalize my study. So during that period, I focus only learning, and if anything that I need to complete before I return home, I have to complete based on the orientation under my supervisor, Professor Dr. Azan Surasak.
Okay, very good. Well, thank you so much for taking the time to speak with us here at International Relations, and we look forward to seeing feedback and more from you in the future. And thank you for initiating our alumnus series here.
Prof, still one thing that I need to add more. In 2020, I got contract from World Health Organization in Timor-Leste to run a project entitled Infection Prevention and Control. When I did the assessment, before I did the assessment, I have got contract with the World Health Organization at the moment. So I was working as a national consultant to run the project. When I finalized the project and all the reports submitted to the WHO country office in Timor-Leste. In 2021, on October, until now, still in process finalizing the document. I have got the contract also. I have got the contract also from WHO to run another project entitled Essential Health Services during COVID-19 period. So I have finalized the proposal and submitted to National Institute of Health, and now I'm doing the desk review and finalize the desk review, and now I'm coming to the to finalize the document, especially for the report. So once the report finished, I will come up with the one article and will be published in WHO link or website. So once published, I will share with the UBU. I think that's all. Thank you very much. My regards to all UBU and College of Medicine, especially College of Medicine and Public Health alumni, especially my college, Emmanuel Kabalisa from Ghana, from Rwanda, and Jackson from South Sudan, and Ricardo from Mozambique. So I hope they are all okay, and they will contribute something to EBU like that. I have an appointment with Prof to do something with EBU, publish our progress, and also update with the COVID-19 progress in the country, especially in Timor-Leste. Right now, we are free from COVID-19 because we are working hard, and even at the night time, 24 hours, we never stop to fight with the COVID-19 in Timor-Leste. We have different team. From the collection sample, leveling sample, diagnosis, and even one team of us on especially for to update the data, especially COVID-19. So we are working hard in Timor-Leste right now to overcome the COVID-19 cases. So hopefully all our colleagues as a UBU alumni, they work hard also for their country to contribute to the development of their or progress of their country. So I think that's all, and thank you very much. Thank you to the UBU, IR International Relations Office, PPATS, that facilitated me to communicate with Prof. James. This is my first time to meet with Prof. James. I hope Prof. James and family stay healthy under COVID-19 storm, especially in Thailand right now. I hope everything went well, and
yes,
thank you, Prof. Thank you.
I thank you as well, Ajahn, and I have to say I'm very grateful to have spent COVID in Thailand, where only 430 died per million, compared to the United States, which is over 3,000. And I was kind of relieved, frankly. I like the safety and health consciousness of the Thai people. It's very impressive. So thank you again for coming, Dr. Rangel, and take care, and all the best wishes in your future great work.
Thank you, Prof. Thank you. Regards to all wonderful lecturers at the Ubon Ratchathani University, especially College of Medicine and Public Health, and President of UBU, Vice President, and all our staff from the UBU. I hope everything went well during COVID-19 period. Thank you very much. Sawadee Kap.
Sawadee Kap.